I want to welcome all of you to this webinar. We have a fairly nice sized turnout, which we of course appreciate, and we hope that you find this of great value. And as Kara has noted, we are recording, and so we intend for this webinar and the information that it contributes to have some good shelf life, and you're very welcome to disseminate it in any ways you would like afterward. So let me just wish you a good afternoon or a good morning, depending on where you are. We are happy to welcome you to this webinar on the topic of menthol products, new research to support local action. This is the first of our summer webinar series that is a collaboration of the University of Michigan Tobacco Research Network and its Smoke-Free Environments Law Project and the University of Michigan Georgetown University Center for the Assessment of Tobacco Regulations, or CAsToR. The Smoke-Free Environments Law Project is supported by the Michigan Department of Health and Human Services and its tobacco program, and CAsToR is supported by the National Institutes of Health and the Food and Drug Administration. So I'm Cliff Douglas, and I serve as the director of the University of Michigan Tobacco Research Network and the Smoke-Free Environments Law Project, and am also an adjunct professor in the Department of Health Management and Policy at the University of Michigan School of Public Health. I'm going to leave the main introduction of our topic today to our first speaker, Dr. Rafael Meza, but we'll just note what most, if not all of you, are well aware of, and that is that the Food and Drug Administration has announced its intention to ban menthol cigarettes as well as flavored cigars. The Family Smoking Prevention and Tobacco Control Act, signed into law by President Obama in the Rose Garden at the White House in 2009, prohibited all flavors in cigarettes with the exception of menthol, and took no action on flavored cigars, among other products. And so the agency's current plan is focused on remediating those gaps. So today we'll be hearing about some of the leading past, current, and anticipated research in this area, intended to inform the policy actions of the FDA, as well as related activity in which I understand many of you are involved in at the state and local level. In addition, we'll be hearing specifically about local action in Michigan and the ways in which these research findings can be effectively translated into policy change. Now I'm pleased to introduce our four outstanding speakers. I can say that as a panel, they bring collective expertise on these issues that would be hard to match anywhere. Thanks to each of you for contributing your time, your knowledge, and your insights today. So I'll begin by introducing Rafael Meza, who is a professor of epidemiology and global public health at the University of Michigan. Dr. Meza is also principal investigator of the University of Michigan Georgetown Center for the Assessment of Tobacco Regulations, and his research focuses on tobacco epidemiology and simulation modeling and lung cancer prevention and control. Next will be David Mendez, who is an associate professor in the Department of Health Management and Policy at the University of Michigan School of Public Health. Dr. Mendez's research is in the areas of smoking control, product and service quality on demand, and policies regarding residential radon. He also served as a consultant to the FDA's Tobacco Products Scientific Advisory Committee, or TPSAC, for which he modeled the potential impact of a menthol cigarette ban. Next will be David Levy, who is a professor of oncology in the School of Medicine at Georgetown University, specializing in population health. And he's also a member of the Cancer Prevention and Control Program at the Georgetown Lombardi Comprehensive Cancer Center. And Dr. Levy, too, served as a consultant to TPSAC and contributed modeling regarding the potential impact of a menthol cigarette ban. And then we will hear from Minou Jones, who is the CEO of Making It Count Community Development Coalition. She currently chairs the Detroit, Wayne, Oakland Tobacco Coalition, and she's the former executive director of the Black Caucus Foundation of Michigan, and has worked in the field of community substance abuse prevention and tobacco control for nearly 20 years and is an internationally certified prevention specialist. Mrs. Jones is an alumna of Wayne State University and Davenport University. Again, as Kara noted, we'll start by hearing from all of the speakers, and then we'll be entertaining your questions, which you're encouraged to submit along the way to conclude the webinar. So now it's my pleasure to hand it over to Dr. Rafael Meza.
Good afternoon, everybody. I hope you are seeing my slides and can hear me well. If not, please let me know. I have the pleasure of introducing the session, or I guess some of the work that will be presented by our two other speakers, and it's an honor to be introducing the work that we've been doing as part of our Center for the Assessment of Tobacco Regulations work, which is at one of the 9 centers of tobacco regulatory science funded by the FDA and the NIH. So while the general topic is about menthol flavorings, and it's not necessarily only about cigarettes, we'll be focusing on the fact of menthol smoking and cigarettes as described or introduced by Dr. Douglas. Just briefly, I want to give some points in terms of why is this relevant, and of course we all know that's the case. So cigarette smoking, CDC reports, causes about 480,000 deaths in the US each year, which is about 1/6 of all deaths. And when you think about it, it's quite a significant toll, of course, still now, even that smoking has decreased from the levels that we had in the 1960s. Around 15 to 19% of US adults currently smoke, and the variability there is depending on which survey you use and which metric, but that's more or less where we are right now. Of course, COVID has maybe made additional changes. One thing that has been happening with regards to menthol is that non-menthol smoking, or the number of US adults, or the percentage of US adults who smoke non-menthol cigarettes, has been decreasing, while the number of people, or the prevalence of menthol smoking, has remained roughly constant. And that has resulted in the fact that more than or a larger proportion of smokers actually use menthol. And using one of those prevalence estimates and estimates of the US population, roughly we come to a number of about 18 million US adults who use or smoke menthol cigarettes. This is just a graphical representation of one of the points made in the previous slide, where the brown dots show prevalence from the National Survey of Drug Use and Health. Where you see non-menthol prevalence, the percent of people smoking decreasing, while the percentage of people smoking menthol has remained roughly the same, although we see maybe a beginning of a decrease. Why do we care about menthol? Because basically it affects the two main aspects that determine how many people smoke and if people smoke, which is the initiation process, how people start. And menthol flavor has been shown to facilitate smoking initiation by reducing the hardness of smoke. But also it's been shown to make it harder for people to quit. So those smokers who use menthol have lower rates than non-menthol smokers, adjusting for different factors. And there's a recent study that I think was published yesterday that is most recent evidence on this. There are important racial disparities, and in particular, Black adult smokers are known to use menthol cigarettes predominantly. We're about 85% of Black adult smokers use menthol. The number would be about 30% for white adult smokers. So certainly there's an important difference there. And majority of youth who are smoking or trying cigarettes, although that number has been decreasing, nonetheless, for those who are actually picking the habit, majority of Black adolescents who smoke use menthol and almost half of white adolescents who smoke. So it remains an important issue right now. And in terms of racial differences, you can see, for instance, the trends of prevalence or percentage of smokers in three racial ethnic groups, which is white adults, non-Hispanic white adults, non-Hispanic Black adults, and Hispanics. And you see that the lowest rates of smoking non-menthol cigarettes are among Black adults. But we look at menthol, basically the rankings reverse, and Hispanics and white adults use it about the same level. And it's really Black adult smokers who are a larger proportion. So it's not only about smoking, of course, it's about what are the consequences of that and of that use. And maybe today what we're going to hear is from Dr. David Mendez on recent assessments of what is the burden or toll that menthol smoking has had in the U.S. and I maybe spoiled the results, but showing some of the numbers that he will be describing, where using simulation modeling, he estimated about 10 million smokers are due to menthol from that period, and that menthol smoking has caused close to 400,000 premature deaths and accounts for 3 million years of life loss. So Dr. Mendez will be presenting more details in those estimations. And as Mr. Douglas was saying, we need to then also think about what is the implications of banning menthol, and FDA is proposing to do so one more time, I guess a new attempt, as well as flavors in cigars. And it's expected that the ban on menthol products would promote cessation and reduce initiation based on the mechanisms of menthol. Recent data from Canada, where they already have a menthol ban, shows that the menthol ban leads to cessation, leads to more quit attempts. And there was an extrapolation that if those figures or that effect would be translated to a menthol ban in the US, then you would have 1.4 million fewer smokers and about 400,000 fewer African Americans who would smoke. And again, but it's not only the smoking, it's also about the health consequences. And Dr. Levy will be presenting recent estimates of what the potential of a menthol ban would be in terms of premature deaths. But we can, for instance, quote an earlier study that he and his team had done before, that the menthol ban would result in this many premature deaths further, and particularly that number among African Americans. Those numbers now have been updated to reflect the current context, and particularly a world where now we have additional tobacco products and where the trends of smoking have changed. So I'll stop here and let Dr. Mendez and Dr. Levy tell us about their work and results. And then we'll also have another speaker.
Thank you very much, Rafael. And could you please let me know if you can see my slides and can hear me?
Yes.
Okay.
Okay.
Thank you very much. I'm delighted to be here. Today, I'm going to present the results of a research project that my colleagues Thuy Le and myself developed a few, and it was published in Tobacco Control earlier this year, and as part of the our activities for the Center for the Assessment of Tobacco Regulation, about the harm that menthol has caused in the United States over the last 4 years. And let me tell you what the background is. I am David Mendez from the Department of Health Management and Policy at the University of Michigan. Dr. Le was the first author of, is the first author of the article. I'm putting my name here because I'm doing the presentation today. So going very quickly back to the 2009 Family Smoking Prevention and Tobacco Control Act, then it charges the FDA and in particularly the Tobacco Products Scientific Advisory Committee, TPSAC, to develop a report that addressed the issue of the impact of the use of menthol in cigarettes on the public health, including use among children, African American, Hispanic, and other racial ethnic groups. But TPSAC, the report concluded that there was not enough evidence to conclude that menthol per se, the menthol in the cigarettes, that substance increased the risk for diseases more than compared to non-menthol cigarettes. So what's the issue? At the same time, the report concluded that the removal of menthol from the marketplace would benefit the public health. So what's the issue? That the substance per se is not causing damage, but it is beneficial to take it out of the market, the products. So what we know is that results from empirical research show that menthol cigarettes are more likely to help smokers, experimenters become regular smokers, and those who smoke menthol cigarettes are less likely to quit, and they are more get more addicted. So this is pretty much the background and the progression of the FDA story or history on the efforts to control menthol cigarettes. This is happened in 2011 with the TPSAC report. Then in 2013, the FDA sought public comments and other information to actually ratify the menthol report, the TPSAC report, and the investigation concluded that ratified the findings in the menthol report, that it was beneficial to take out of the market. And in April of 2021, the FDA announced plans to ban menthol cigarettes and flavored cigars. So what has happened is that research like David Levy's research in the prospective effect of a ban, and the TPSAC report also look at the prospective damage that menthol would cause over the next 40 years or so. So it's a future damage if things continue as they are, and Dr. Levy you address the potential ban, the potential effects of a ban. So the objectives of this current research that Dr. Lea and I engaged on was to figure out what is the damage that menthol had already caused in the population over the last 40 years. Not what it's going to do or the perspective of what's going to do, but quantified. We know menthol, is or we claim menthol is harmful, but how harmful has it been? For that, we to do that, we developed a model, a simulation model that keeps track of menthol and non-menthol smokers, and with certain specific parameters for menthol smokers and non-menthol smokers, which have different initiation rates and different cessation rates and so on. Then we were able to just quantify what was the damage of menthol. So we use we did the following exercise. So using published sources, then what we did is we developed a simulation scenario that replicated what happened in the US from 1980 to 2018. So we calibrated a model to say, okay, this is the prevalence that we observe from 1980 to 2018. Let's replicate that prevalence using our model to make sure that can reconstruct what happened. And then after we did that, then we took the mental effect on initiation and cessation. We removed that and constructed another scenarios. What would have happened if mental or let's say, what is the part that mental is responsible for from that prevalence, okay? Not exactly what would have happened if we had removed mental, because other forces could have been in play. But what we can tell is out of that total prevalence from 1980 to 2018, and the damage from 1980 to 2018 that's caused by tobacco, by cigarette smoking, we can compute what part of that is mental responsible for. And so we quantify that damage in terms of smoking-related premature death, life year loss, and then excess new smokers. And these are our results. First, if you see the top two lines, the circles and the triangles and the pyramids, are the observed NIH prevalence from 1980 to 2018, and the and our results from our model that it keeps track very well of that that prevalence, right? And then when we remove the mental multiplier or the mental effect, then we obtain that bottom line here, which is the hypothetical or the counterfactual, right? What would have been the prevalence removal of mental, and that with, of course, so confidence intervals around that. So the difference that you see here would be the responsible, the part that is mental responsible for. So when we quantify that, we found that the menthol cigarettes were responsible for slowing down the decline in smoking prevalence by 2.6 percentage points. So in 2018, the prevalence was 13.7%, and it would have been 11.1%. It had it not been, or mental was responsible for that difference from 1.1% to 13.7%. And about 10 million, so mental was responsible for about 10 million extra smokers, which is over 40 years, about 266,000 additional smokers per year, and 3 million life year loss, which is about 378,000, I'm sorry, 3 million life year loss and 378,000 premature death, which is about 9,900 premature deaths per year that were caused by menthol cigarettes. So on top of that, and that is not shown here because this is an ongoing research that is under review now. The African American population, the burden on the African American population was disproportionately high. African American population is about 12% on average of that population over those over those 40 years, and it took about over 40% of that damage, or over 40% of the 378,000, where can be, where the African American burn about more than 40% of that 378,000. So it's quite disproportionately, given that they are just 20, African Americans are about 12% of the population. So, but that's that's a research ongoing right now. But so our conclusions, menthol cigarettes are responsible for millions of excess smoking initiations and smoking-related death. And what is also very important to note, is very subtle, is that the harm doesn't stem from, menthol is a substance that is causing damage directly to the body of individuals, but is a substance that facilitate the use of tobacco, the use of the prevalence of smoking, because it makes initiation easier by smoothing the harshness of of smoking. When kids start to smoke, that freshness and or the harshness that they might feel, it's attenuated by menthol flavor. And also it's actually established that individuals that smoke menthol cigarettes are more addicted and have more so a harder time to quit. And those two facts makes the result is that we get more smokers that initiate, who smoke longer, and then increasing the harm of tobacco. So with that, because of the issue, that's a population health risk, right? Rather than looking at an individual and an effect of a substance directly to an individual. So that's what I would like to, I wanted to present it today. And Dr. Levy is going to talk now about the prospective, effects of banning menthol. So we presented now, I just presented what was the damage that menthol have done, what's the magnitude, and and Dr. Levy is going to present what can we expect from a menthol ban. So I want to acknowledge the support from our grant, and thank to the data core for providing a lot of information and data about menthol parameters to populate our model. And thank you very much. Dr. Levy, the floor is yours. And let me stop sharing. Hold on.
Okay. I think we're good. Let me just, can you hear me okay?
Yes.
Yep. Okay, so as David said, he presented some results looking at the impact that menthol smoking has already had, and I'm going to project forward and look what kind of impact there might be if a menthol ban is actually implemented. I'm doing this, those of you who've seen my talk before, you're more familiar with my SimSmoke model, one of which I developed for the state of Michigan. Today, I'm going to use a model called Sable, which is a simpler model, but it has an added complexity in that it includes what I call nicotine vaping products. I'll probably refer here to them as e-cigarettes, or ENDs is probably the term you're most familiar with. And in doing this modeling, we first did a review, which we published in BMC Public Health, and there were some missing links in that. In other words, we had evidence from Canada on the effects of cessation, but not so much on initiation. And so we did an expert elicitation. And I'll talk a little bit about that first. When we did the expert elicitation, we looked at different variations of a menthol ban, but the one that makes the most sense is one that's applied not only to cigarettes, but also to little cigars. Yeah, fact is, not a lot of difference between cigarettes and little cigars. And then especially when you look at, racial ethnic differences in use, it becomes important if a menthol ban is to be effective, that it is applied also to little cigars. We did our expert elicitation, and I'll be focusing on the results where we apply a ban to little cigars as well as cigarettes. And what I have here's just kind of a diagram, give you an idea of the complexity of what we look at in the expert elicitation, but also in the modeling. We have never smokers. They can become e-cigarette users or non-menthol smokers. But the interesting part with a menthol ban is those who would have initiated menthol smoking. They can still get illicit menthol cigarettes. We asked, our panel about that. Probably more likely they'll switch to non-menthol cigarettes, or potentially switch to e-cigarettes, or potentially quit everything and become never smokers. And we're thinking of this in terms of regular use, not just temporary use. So here's our estimates of the impacts you have for those people who would have initiated and become menthol smokers. What these results indicate, again, from the expert elicitation, 40% of them will still smoke, but almost 40% will quit. They won't continue as smokers or use of any kind of nicotine product, and about almost 20%, 17.6%, will switch to e-cigarettes. Here we call it novel nicotine products, so it also includes heated tobacco. Okay, so those are the people who would initiate it. When you project forward, that's kind of our future generation. We also look at those people who already were already are menthol smokers. And what could happen to them? They could become former smokers, they could switch to e-cigarettes or whatever. All of these, once menthol bans, menthol cigarettes become less available. And I forgot to mention also, they could become illicit menthol smokers. This is an issue you have to deal with, be it if a ban is implemented in the United States, getting things internationally, or some other way, or states getting from cross-border. Okay, so here's our results here. You don't see as dramatic of impacts. In other words, about 75% of the people continue to smoke. But you do see a pretty large proportion, 12.5%, quitting. Now, we net out the percent that would have otherwise quit, just because some smokers do quit. But, still, it gives us roughly about 10% on net quitting as a result of the menthol ban, and about 10% switching to e-cigarettes. I'm kind of glossing over the smokeless tobacco. The effects there ultimately the absolute difference is pretty small. Okay, so now we have our inputs to our models. And so we plug it in this model, the Menthol Sable model. This is a newly developed model. It starts off in 2013, and we have done some validation of the model. So, you know, it's not just, you know, we've been developing it for a while now. But what we do here is we look at the effect of a menthol ban implemented in 2021. And one of the assumptions we make here, which, you know, is, I'd say a conservative assumption, is that the risks of menthol versus non-menthol are the same. And that's important because you want to know if people switch from non-menthol to, or from menthol to non-menthol, do they lower risks? There's some literature that indicates that they might, but the results aren't real clear cut, so we try to make the conservative assumption here. And in this model, although we use the results related to little cigars, we don't explicitly model cigars. You know, that's just much more difficult. We wanted to get at the effect on each cigarettes. But again, it's important that the ban does cover cigarettes and little cigars so that we don't see people switching over to menthol little cigars. This gives you, you know, there's a lot of stuff going on here, I know, but, you know, this gives you a diagram of the different transitions that individuals can make. They start off as never smokers, and then if they initiate, they can become, before the ban, either menthol or non-menthol smokers, or they could become e-cigarette users. You know, we're seeing, you know, a fair percentage of people becoming e-cigarette users in the last, you know, 6 or 7 years, and that's incorporated in the model. And then we allow the individuals to quit at various rates. And, you know, this would be the model absent the ban, but the same kind of things would happen, except we'd see switching from menthol smokers to additional menthol smokers switching to e-cigarettes based on our results, and more quitting. Okay, oops. So we calibrated the model, you know, and you know, one of the things you should realize, I think David mentioned it, is, you know, the trend, and Rafael mentioned, the trend is increasingly towards menthol smoking. And our model was calibrated to take that into account. You know, so menthol smoker, you know, although smoking rates have declined quite a bit in the last couple of years, we haven't seen much of a decline, if any, among menthol smokers. So that's important to keep in mind because, again, that they're likely to have a greater and greater presence in the future. Well, this is what I call the base case with, you know, what we consider our best parameter estimates. And what you see here is, first you have the menthol status quo, that's without a ban. And you see here that we project, you know, smoking rates declining, you know, based on what's been happening. You know, the combined rates as of 2021 were about 13%, but declining over time. And at the same time, I don't have e-cigarette users. E-cigarette users were projected to increase over time. Then we have the menthol ban scenario, and you see here in 2021 we have, this is right before the ban, 5.4% are menthol smokers, and it declines to pretty minimal numbers by 2026. Non-menthol smoking does increase, not a real lot, however. Overall, then, what we did was we calculated what happened. There's a 92% reduction in menthol smokers. You know, there's this residual amount that are illicits. There's a 47% increase in non-menthol, but don't forget, they're the declining group over time too. So, you know, that's important to take into account. E-cigarette use under a ban does increase to 23%. I should have included the rates in the absence of a ban. I believe it was, we projected something like 15%. You know, we tried to give conservative estimates. And again, keep in mind here that we're looking at regular use. So it's something more than last 30-day use. Okay, and this gives you some graphs. Again, menthol smoking, you see pretty drastic declines. You see slight increases in non-menthol smoker, although starting, you know, but declining over time. And then if you look at overall netting out, you know, the reduction in non-menthol from that, the increase in menthol, what you see is there's a reduction in, I think there's a mistake here. There's a reduction, the first graph is the relevant one. There's a reduction in smoking indicated by the blue line. Sorry, there's a bit of confusion here. Oh, I'm sorry. The second graph shows the increase in e-cigarette use. So here you have the comparisons, and you can see how that's changed. These are both for females. You see similar kinds of things for males. Okay, we did a lot of sensitivity analysis. You know, we estimated the e-cigarette use at 15% of cigarettes. I would consider that fairly conservative, but you know, at the same time, there's a lot of controversy. So we looked at, you know, variations, and the variations didn't make a tremendous amount of difference. But I should add, there are some people that think that the risks are greater than 25%. And, you know, the higher and higher you get, the less, the more of a difference it makes. You do see that overall cessation rates are very important here. You know, and also the assumption about how menthol relate to non-menthol relates. You know, e-cigarette initiation and cessation doesn't make a real lot of difference here, as it turns out. But again, that's, you know, we're looking here at deaths, and these figures are based on, you know, risks at 15% of e-cigarettes relative to smokers. So in conclusion, our results do suggest significant benefits in terms of the #1 killer, which is cigarettes. And a menthol ban has the potential to have large effects. And I didn't present the results here for African Americans, but there's even bigger percentage effects for African Americans, both in terms of smoking and, more importantly, in terms of reduced deaths, so that there's you know, a reduction in disparities by banning menthol. You know, the estimate, the results do depend on the estimate of e-cigarette risks. But, you know, we looked at 5 to 15%. You know, I'd say reasonable ranges. Some people think the risks are as low as 2%. Yeah, I'm not sure I believe that. Others at 40%. And, you know, this is just one of the uncertainties we face. And you know, as those risks get bigger, there's more of an issue. We did the sensitivity analysis, and you know, just you know, I want to point out that the modeling does make certain assumptions. It assumes that policies continue pretty much as they are now, both for cigarettes and for e-cigarettes. In other words, if there was a drastic reduction in the availability of flavored e-cigarettes, you would see less substitution towards e-cigarettes, but at the same time, some of that would translate to increased smoking of combustible cigarettes. So on that note, thank you.
Okay.
Great, and then I can pick up from here. So before Minou speaks, I'm going to just go over some data that is from the Michigan Department of Health and Human Services. Fareed Chamo has graciously provided me some slides to share with you about a recent study that was done in Michigan. So let me share that screen. Okay, and present. All right, so this, what I'm going to present is the African-American tobacco use study that was done in Michigan. This was commissioned by the Black Caucus Foundation in Michigan, and it was done with African-American smokers across the state. It specifically shows in some counties what was going on, and this local data can really be used in the future to help understand at the local level, in addition to what we now have just learned about the national level and what we can expect there. So the key findings of this were that there was a clear generational gap between the understanding of nicotine and tobacco use, and that there were certain things that older smokers did versus what younger smokers would do. Additionally, 2/3 of the current smokers wanted to quit, and they provided some information about what methods had helped them and what didn't. And then less than half had heard about the Michigan tobacco quit line, which is of course concerning because this is a way that we could connect more people to smoking cessation. And this is just Michigan, but that could be the case elsewhere also. So getting quit line information out would be good to do. So while everybody was a smoker, people use different products, right? So 1/3 of the participants used e-cigarettes. And in the last 30 days, it was mostly the younger participants who said that they had used these. Older were less likely to use them. And there's a lot of information on these slides. I'm going to kind of breeze through them, but I'm happy to provide the slide set to anybody who would like it in the future. Additionally, only 1/5 of participants were using a smokeless tobacco or hookah. So again, this is younger folks are using a larger variety of products. Same with cigars, little cigars or cigarillos. There was a younger population that was using these. It's less likely that the older population is doing this, and females are also less likely to use some of these other varieties of products, especially the cigars and cigarillos. Between the ages of 12 and 24 is when a lot of these African-American smokers started smoking, and you'll notice that more than 60% of them started before they were age 18. So this is a huge concern that the youth are getting involved in smoking early in Michigan. And we can see that they were also starting with menthols usually. So this brings it back to menthol, of course, which is very important within the African-American community, as this community has been targeted with menthol advertisements for a long time. And it shows that there's an uptick in use of menthols because of that, especially among youth. So this is what people are most likely starting with. And almost half, 46%, were using only menthol cigarettes when asked during the study. So that just shows how prevalent this is, and how any policy that we're doing about menthol is going to impact African-American communities the most. So keeping that in mind while we're changing policies and seeing where the impact is going to be important. Additionally, the flavor preference is also skewed toward menthol as compared to other flavors. So this is something to keep in mind, that even among other flavors, when it's available in cigars, cigarillos, vapor products, there's a skew toward menthol still. There was also just over half of the African-American smokers in this study that realized that were aware of the targeting of African-American communities. So there could be some more educational efforts done around that because it's not very well known by the smokers what is going on with the targeting of advertisements and such. Getting to more quitting and cessation talk, over 90% had been talked to about tobacco use. It was, of course, less likely that uninsured individuals would be asked about this because they likely aren't going to go see a doctor as others are. Additionally, younger people were not asked as much about this, so it does seem to be on the older side of things. 3/4 had their doctors advise them to quit. This was in the older age brackets, as well as people who had more money. And again, uninsured people are not receiving this type of advice, likely because they aren't able to access this type of care. There was also a large majority who realized that tobacco products are harmful. This is good, but there does appear with less than high school education to be some issues there. So this kind of was helpful in targeting, who might need more information. Same with secondhand smoke. The large majority thought that it was harmful, but there's some more education to be done there. So that was highlighted by these study results. And over half of nearly half were highly concerned about their tobacco use and were interested in quitting. So this kind of shows across demographics, and that provides useful information to see who's willing to receive some of those messages about cessation. And as pointed out earlier, 2/3 of the tobacco smokers currently wanted to quit. So really, a lot of people do want to quit. And as we know about menthol, it can be harder to quit when you're smoking like menthol cigarettes or et cetera. So this shows a high need and a need to give more resources and especially get them to people and provide more information. People thought the best approach would be quitting cold turkey. And this seems to be what they wanted to use now and have used in the past. Here again, you see that cold turkey is the highest method, even compared to medications that are out there, compared to e-cigarettes, anything, it's cold turkey that people are relying on. And that's what they say they would rely on in the future as well. So it is an opportunity to provide some information about these other methods that might be able to help them, because cold turkey can be really challenging. And finally, under half of people, the African-American smokers in this study, were familiar with the quit line. So in addition to wanting to quit and not having very good information about it, or thinking they just want to go cold turkey, this could be a good idea just to get information out there so they have somebody to call and talk to and assess what would be best for them. I know I went through that extremely quickly, but that is so that we could hear some comments from Minou today. I am more than happy to provide those slides to you. There was a bit more information about flavors and et cetera, if you are interested in looking at that. But the main reason to kind of show you the survey was to let you know that that information is out there and it's available locally. So, on a county basis, which is really wonderful. So I'll let Minou talk about the kind of impact that has from a community organization.
Thank you. And, I'll make my comments brief as well. I'm respectful of everyone's time. Making It Count Community Development Corporation's mission is to, increase the overall equity and inclusion of its community members by providing meaningful opportunities. So there are 3 key takeaways that I want everyone to understand, and the importance of data collection for community use, especially at the local level. It gives us an opportunity, one, to identify and prioritize problems. As you know, there are a lot of problems, in communities that are underserved. The data, we know that 45,000 Black lives are lost each year to tobacco-related illness and disease, and that African Americans are disproportionately impacted by death and disease. So that makes it a priority for us. The data collection that's been done at the state level by the university and through the study by the Black Caucus Foundation of Michigan helps us not only prioritize it as a problem, but then garner support from additional stakeholders. That can be volunteering to participate in our committees, donating in-kind services and funding. Thankfully, this effort is being supported by the Michigan Department of Community Health tobacco section to address tobacco-related disparities right now in Detroit and Wayne County. And we're doing that with help through the Center for Black Health and Equity, along with support from over 44 stakeholders, including the American Health, American Lung, American Cancer Society, members of the LGBTQ community, faith-based organizations, and of course, the Smoke-Free Law Project. And then the third part is that it guides our planning, implementation, and evaluation. So, one of the things that we learned when we presented some of the initial findings in our town hall meeting for Black History Month back in February was that, many stakeholders, particularly voters and African Americans, were just not aware that this is a problem, the magnitude of the problem and how it disproportionately affects African Americans. And so, because of that, it gives us the opportunity to begin to develop educational campaigns, identify target audiences who we need to reach, and then, gives us the metrics to understand and establish short-term, intermediate, and long-term outcomes. I like to say I'm very thankful of the support that we've had from the Smoke-Free Law Project, Michigan Department of Health and Human Services, Tobacco Control Section, and the Center for Black Health and Equity. Being a community-based organization and being at the grassroots level, small organizations, especially nonprofits, struggle to find funds that are available, and really develop strategic plans that will amount to population level impact. So this work is extremely important. Making sure that the information is able to be easily understood by community members and elected officials is equally important. And I look forward to the continued work and support from our partners and stakeholders. That's it for me. I'll turn it back over to you, Cliff.
Wonderful. Thank you, Minou. And thank you to all of you for just what's really together collectively been a fantastic discussion already. We do have some questions that have come in, really intriguing issues that have been raised. And one has been addressed by a couple of folks in the chat. And I thought I would just start with that, though. And the question there, and Minou, I think it would be really terrific to hear from you and have you weigh in on this, which is, how do you respond to the ACLU objection to the menthol ban, which is that making menthol use illegal will increase the incarceration of Black smokers, as evidenced by the history of the war on drugs? We have had a couple of responses from Rafael, from Greg Hampshire, which address some of this, but Minou, I trust that you'll have some thoughts and insights there that might help guide us.
Yeah, absolutely. So, in my bio, you mentioned some of the work that I do. And in my former work, I was over the FDA tobacco compliance check program for the state of Michigan. And, the FDA does not, they have their own enforcement. They are enforcing manufacturers, retailers, and distributors. So this isn't a situation where, law enforcement is going to go and start picking on Black folks or smokers. This is enforcement by FDA. FDA does not enforce the action of people. They enforce retailers, manufacturers, and distributors, and they have their own enforcement pieces. The truth of the matter is, being a native of Detroiter, and seeing the work that has been done in other states where menthol has been banned, the police departments don't have the time or resources to be policing with someone, a cigarette smoker. So it's just, it's a false concern, you know, and the truth is we're going to save Black lives by implementing the menthol ban.
Thank you. One of the points that I think has been amplified in a couple of the chat responses is that local implementation enforcement focus on sellers, not on consumers, not on the buyers, the users, and that may be easier than done. Greg also noted that he challenges the ACLU's position based on the fact that they have a history of taking money from the tobacco industry. I can tell you, by the way, that way back early in my career, I mean, literally in the early 90s, I participated in producing a report on that very issue. I don't know if anyone here happens to know, I don't, what the ACLU's connection to industry funding may be now. I don't know if there is that connection or not, in all honesty, but it is one of those things that we of course look at when we think about the issue of potential conflicts of interest. So let me move to another question that's been posed. Dr. Levy referenced the fact that while not modeled, the effects of a menthol cigarette ban will depend in part on policies toward e-cigarettes, especially the availability of flavors desired by smokers. The question is, can you say more about that? Also, will there be more research on this issue of flavor use by adults in vaping products in support of their interest in quitting or harm reduction?
Yeah, I'd be glad to speak on that. And funny you should ask, our T-Course is now looking specifically at the impact of flavors on e-cigarettes, and we'll be focusing on that. And it is a very complex issue. On the one hand, we do know that there have been flavors that have attracted youth, like gummy bear, or things, flavors like that are clearly directed at youth. It seems like the FDA is making sure that the most blatant cases are being disallowed. At the same time, we do have good evidence that smokers who want to quit smoking, and it appears there's a lot of them, and it especially appears, some work that I've done and I've done with Rafael, a lot of 18 to 24-year-olds are not smoking now, but are using e-cigarettes. The evidence seems to indicate, we're just really looking at this in detail now, that flavors are important, particularly for people who don't want to be smokers. If you're a smoker, usually you'll use a flavor other than tobacco flavor. And in particular, I mean, the kind of proposals that the FDA has made, because they're seriously considering a menthol ban right now, is to limit the flavors, but to make sure that menthol and mint flavors are available if they do a menthol cigarette ban, in order for there to be a way for people to transfer out of cigarettes. So I hope that answers the question.
Thanks, David. Are there thoughts on that question from anyone else? Just to give you the opportunity. A related question was posed here, which indicates how should menthol and other flavors be addressed in other non-cigarette products? It notes that the The policy being pursued by the FDA does cover cigars, and that would include small cigars, which is a critical issue for some populations, and certainly including kids. But this asks about how to address these issues in e-cigarettes and in other products like dissolvables. There's kind of a spectrum now, or plethora of nicotine-containing products on the market, all under the jurisdiction of the FDA. And the question extends potentially to state or local action, since the FDA is not the only player in this game. So I'll put it out there to any of you to address.
Well, I'd be glad. I'd be glad to say something on that. I mean, you know, the whole e-cigarette issue is a very, very complex issue, you know, and we don't have the answers, you know, and at the same time, we do see major shifts in smoking, and you know, it creates difficult issues for us. And it's not just a matter of doing the same thing with cigarettes that we do with e-cigarettes, that is, you know, limiting or banning them. In many ways, it's much more difficult because e-cigarettes are, to a large extent, an internet phenomenon. There's also vape shops. Vape shops probably could be better controlled, but you know, tobacco, particularly e-cigarettes, has moved to the internet. So it raises some very difficult issues in terms of how to handle things. I mean, the way I see things, I mean, I think clearly we're going to see limits on certain types of flavors. There'll be perhaps limits on the extent of nicotine in e-cigarettes, which could potentially make it less addictive. You know, Juul has a high nicotine concentration. So it's a very complex issue, you know, and you know, I don't want to tell you that I know the answer, because I don't think anybody does. The only thing I will say is we have seen dramatic reductions in smoking in the last 6 or 7 years, particularly among those ages 24 and below.
Okay, thank you, David. I see that a hand was raised, so let me turn it over to you, Spencer Raxter. If you'd like to unmute and pose your question verbally, that would be fine.
Yeah, thank you. I just had a question about, you know, the e-cigarettes. Like, I remember Juul had a ban on flavored cartridges being sold, and there was only at one point only the tobacco flavor or other flavors like that were available, but then different brands of e-cigarettes came in and just took the place of all of those Juul pods being sold, like Breeze and Mr. Vapor and things like that I've seen in different stores. And I was just wondering, is there, I don't know, the difference between that and how one brand of e-cigarette can be banned like that to sell those type of flavors while others just take their place?
Well, I could say, I mean, the FDA is going to be trying to limit, you know, the e-cigarettes on the market. You know, it's taken a long time, but, you know, now there are requirements that producers, sellers need to get approval through the FDA. How's that going to work out? I don't know. Again, it's unclear.
And one thing is that the Juul took some of those flavors on their own out of the market. I don't think FDA has made any ruling yet on removal of flavors, and I think Juul had to deal with the backlash of certainly having that huge amount of uptake among youth, and largely driven by their brand, that they took certain actions, including removing some flavors from the market. But yes, that didn't stop other producers or other companies from keeping and I guess taking advantage of that void. I think we're in a whack-a-mole environment where you deal with something and something else appears. So I think that's why it's critical that the will come up with some guidance and ruling so that at least the rules of the game are clear, and then we can start seeing, of course, how industries respond to that, and also how us as public health practitioners, tobacco control folks, and others, how we can make sure that whatever ends up being available, we prevent youth from using or taking up any product that is available, and yet also take advantage of the potential that they have for helping current smokers and I guess combustible tobacco product users, maybe considering them as an alternative if it can help them drop those more harmful products.
Mhm. Thank you. Well, we are winding down on time now, and I want to thank everyone for a terrific discussion. This went very quickly, and anytime you have a group of folks together in a good event, that's inevitably how it feels. Before I turn it back over to Kara, I want to thank Kara again for her efforts in putting this event together. Kara is a doctoral student here at the University of Michigan School of Public Health and does a fantastic job of simultaneously serving, sometimes rather superhumanly, as the manager of our Smoke-Free Environments Law Project. So we're grateful for everything you do. Of course, I also want to thank all of our expert panel of speakers again for all of your time and contributions to the discussion. We are going to be making this session available in recorded fashion afterwards. So thank you all for attending. Let me turn it back to Kara again for closing.
Great. Yeah, I just wanted to reiterate that this is going to be recorded and sent out. So if you're unable to be here for the full portion or have other colleagues you'd like to share this with, that will go out to you shortly. If you would like any of the slides or contact info for any of the speakers to ask other questions, please just email me. I think you should have my email now. And I really appreciate you all for being here. It was wonderful and could not do it without you participants and you wonderful presenters. So thank you very much. And I think with that, we'll close.
Thank you.
Bye.
Bye. Have a great day, everyone.
Mhm.
Thank you.
Bye. Thank you.